Hello, everyone. I want to wish everyone a very good day and welcome to our virtual world. You know, I don't know about you, but this pandemic's getting a little old, but we must continue to persevere. We must advocate and practice established scientific guidelines and practices. And we must protect ourselves, our families, and our patients. And most importantly, I want to remind you, look out for your own personal wellness. This virtual world can have a negative impact on our personal mind, body, and spirit. But we must strengthen our personal support system. So please keep this in mind. I want to tell you a little bit about what's been going on since July. At the February 2020 mid-year meeting, the AOA Board of Trustees approved a new AOA governance structure. Bureaus, councils, and committees, and a few task forces were reduced from 52 entities to 28 entities. The bureaus, councils, and committees with redundant structure were retained and accommodated under the new bureaus, committees, and councils within the new structure with the purpose of improving efficiency. All functions and roles of the 52 previous entities have been preserved in this new organizational structure, except for the small number that concluded their functions upon completion of the transition to the single GME accreditation system on June the 30th. This process was done to streamline decision-making, reduce conflict in decision-making and communication, and to reduce operational expense. So Dr. Clower, who oversees the AOA's operational departments, and I and the Board of Trustees oversee the AOA's governance departments. Dr. Clower and I have established clear goals and objectives for all of our entities. And he has 74 established goals for the operational departments. And I and Dr. Clower met with every bureau, committee, and council chair to ensure that they understood the direction we were going, the goals that we wish to obtain over this coming year. And this was done for the purpose of having an aligned, common goal that we would meet at the end of the year. At my inaugural address, I stated that I had 3 specific goals. And the first was to expand the osteopathic community. And we're going to do this by promoting AOA membership. We're going to create a new member value proposition. We're going to refine and upgrade the AOA brand campaign so that it will reflect greater understanding and awareness of our profession, not just that we exist. And we're going to further collaborate with the AACOM on the Choose DO program. My second initiative was to support the future of our profession. And we're going to do this by emphasizing the expansion of osteopathic recognition in our graduate medical education residency training program. We're going to collaborate with SOMA and the COSGP to enhance the AOA's support of our osteopathic medical students. My third initiative was to enhance the AOA's public health mission. And we're going to do this by identifying annual public health initiatives. We're going to promote public health research within our osteopathic community, and we're going to develop resources to address healthcare disparities and access to care issues for underserved populations and communities. The affiliate relations department now is hosting quarterly town hall meetings with our state and specialty societies. We have seen more transparency and coordination and communication and participation with our affiliate societies. This is going well, and it's really helping us support the affiliates. The Bureau of Osteopathic Specialists is now working more efficiently, cooperatively, and transparently on improving osteopathic board certification. Our certifying boards are fast-tracking efforts to bring additional remote examination options online. And the American Osteopathic Board of Internal Medicine has now established that for the 2020 year. We have 4 boards: anesthesia, emergency medicine, obstetrics and gynecology, and radiology, that have replaced the traditional high-stakes in-person written exams that occurred every 7 to 10 years with longitudinal osteopathic continuous certification exams. And more boards are looking to initiate these initiatives in the near future. In our governance department, we continue to advocate for our profession and our members at the federal and state levels. We have an osteopathic advocacy network, which is really a grassroots network. And we've been working with the federal and state legislatures on supporting reauthorization of teaching health center graduate medical education bills, increasing GME funding, bills that would eliminate surprise billing, bills that would limit inappropriate scopes of practice for non-physicians, bills that would protect our seniors from prior authorization abuses. And we're supporting the Dr. Lorna Breen Healthcare Provider Protection. In September, we held a virtual Affiliates Day on the Hill. So representatives from the individual state affiliates and members of AOA leadership met at specific times with legislative staff or members to talk about those bills that we were bringing to their attention that day. It worked very well. And we will probably continue something along these lines in the future. In our research and public health department, there is a new emphasis on the AOA's and the osteopathic profession's reinvigorated role in public health and quality osteopathic research. Our membership department. This is an area that needs assistance. I need your assistance. You know, over this coming year, we will grow to having more than 127,000 osteopathic physicians. But only 19% of these physicians belong to the AOA. Only about 30% of the osteopathic physicians in the individual states belong to their state societies. Some larger states have a little greater percentage, but the majority are in that 30 to 40%. This is not good. I need to represent all osteopathic physicians. I need all osteopathic physicians and osteopathic medical students to participate with us, to belong to their state and specialty societies and our national association, the AOA, so that we can have their input and guidance and know what they want from us and what they want us to do for them. So we will be initiating an aggressive membership campaign, and I seek your assistance when this is rolled out. And lastly, I must address the assault on our profession. A week and a half ago, as the President of the United States battled COVID-19 under the care of Sean Connolly, DO, his personal physician, and a team of supporting physicians, the nation's 151,000 osteopathic physicians and medical students were confronted with a wave of confusion and broad mischaracterizations of our osteopathic medicine. Comments made online and in printed news made it clear that many in the media and a few celebrities do not understand the scope or status of osteopathic medicine. Many incorrectly implied and in some cases outright claim that osteopathically trained physicians, DOs, us, are less qualified than allopathic physicians, MDs. So one day I was standing, beaming with pride, as I witnessed the president's personal physician on national television in a white coat, proudly displaying the letters EO after his name. The next day, I was sitting, and I felt like I had been hit in the gut as I witnessed and heard news media disparage our profession. So I and the Board of Trustees commend Dr. Clower and his AOA staff for their timely, aggressive public response to these libelous insults. Your Board of Trustees fully supports this response and the upcoming revision to our AOA brand awareness campaign and the upgrading of the Journal of the American Osteopathic Association. I consider this a call to action. Support us. As I told you in July, I want to raise the pride in our profession. So I have a new motto, a new mantra, and it's simply D-O proud. And I want you to remember that your AOA and the osteopathic profession are physician-governed and physician-led, and that we represent you. I would like to thank our AOA staff, our affiliate associates, both state and specialties, you, our delegates. I want to thank our MD colleagues who have reached out and supported us over this past weekend, and our colleges of osteopathic medicine. I thank all DOs, all of our osteopathic medical students, and our patients who have spoken up in support of our profession. We're going to do great things this year, and the world is going to know more about us. Thank you, and have a wonderful day.